I would like to take this time to introduce Tara Hodgson. She's the program head for the pediatric nursing specialty.
Hi, everybody. So I'm Tara. I'm the program head for pediatric specialty nursing and pediatric critical care nursing. So who is this for? This is for RNs. You already have to be an RN to be in our or you can be a BSN student and take the first 2 theory courses. So you, first of all, obviously need to like working with kids. Pediatrics ranges from newborns to 18 years old. So you can always find something you like. My favorites are 4-year-olds and teenagers. Not my own teenagers, but other people's teenagers are pretty great. So, you know, you can find your jam somewhere in that. It's basic, pediatrics is basically med surg, but with smaller people and less drama than grown-ups. So you have to be a critical thinker. You have to have strong interpersonal skills. You have to be creative. It's really important because, you know, sometimes a 2-year-old doesn't want you to do things to them. So you have to kind of come up with different ways. They said, but half of being a pediatric nurse is being a detective and figuring out what your nonverbal, you know, patients are going to be able to tell you and not be able to tell you. And sometimes it's a bit of guessing and detective work. So, and then you have to really be willing to change your communication based on that person's developmental level. So, you know, how you talk to a teenager and how you talk to a 2-year-old are completely different. And you might have both of those patients on the same shift. So, you know, you have to be willing to think outside the box a little bit. And our specialty program you can come into even if you don't have PEDS experience. Next slide, please. So the overview is similar to the other ones. I think you can kind of read it yourself, but the pediatric special needs program focuses primarily on acute care setting. There is one other pediatric program now in Canada. It's at Mohawk in Ontario, but they really focus on community-based nursing, and we're the only program that really focuses on acute care nursing in Canada. So the courses, we have 4 theory courses, 2 clinical courses, and then we have 7 elective credits, and you can take elective credits in any number of things. For example, we have contraceptive management course and sexually transmitted infection course, which is part of our perinatal program, but those apply if you're working with adolescents. We have breastfeeding courses that could be an elective, and we also have electives within our own program. So we have lots of options. And it's also, if you've done things in your career already that are involved with pediatrics, NRP or PALS, you can get credit for those as electives as well. So most of the time it's part-time like everybody else. It takes about 2.5 years to complete, but again, we have up to 7 years. And we do the distance and online learning. So it's, and then you could do a CTF in the basic PEDS, although most health authorities don't sponsor in that area. So it would be mostly distance that you would do it. And of course, the clinicals, we will, everybody wants to go to Children's Hospital, but I'm here to tell you there are other excellent pediatric hospitals in BC. So we can arrange your clinical placements at those hospitals as well. And so this is my contact information and my program assistant. This information is also on our website. So if you are like scrambling, like, how can I write this down? Don't worry about it. Just go to our website and it's on there.